All right. So a cardiovascular assessment in a newborn is very similar to that of an adult. It's very much the same process. There's just some, different things that can occur in a newborn. So first you're going to kind of look at them, see how your newborn looks. You're going to see if there's any color changes because sometimes that can mean that there is a cardiovascular issue occurring. Sometimes diagnosis can indicate that there is something like congenital heart defect going on. Then I like to check my baby's pulses just to, see how they're doing so you can feel there's multiple different places. You can try radial. We like to do brachial. They're just a little easier to feel in newborns. You can usually feel pedal too, but we do popliteal, and just feel and make sure that they've got good, strong pulses. One thing to note is that babies do have a much faster heart rate than adults, so that's something that you want to keep in mind when you are assessing, and sometimes it can be harder to count. But sometimes it helps to kind of tap along, and that can help you count to make sure that you're getting the right pulse for your patient. So you're going to go through and you're going to, feel everywhere, make sure they have good capillary refill, less than 3 seconds, and everything looks good so far. So then you're going to want to listen to your patient, and a lot of the time I end up listening to my patient's heart as I'm listening to their breath sounds, just because you're already listening and kind of in that area already. But you're going to take your stethoscope, and you are going to listen to your baby's heart rate, and you're going to listen for S1 and S2, and just like an adult, if you hear S3 and S4, then you're going to figure out something's going on. Murmurs, so murmurs can be common in newborns. Just depends on what's causing them, and that's something that you definitely want to keep an ear out for when you're listening. So you're going to listen. Right. Great. All right. And then when we're all done, you can move on to the next assessment.